Good morning, Lizette. So good to see you again.
Good to see you too. It's great to be here. Thank you very much.
I'm really looking forward to this conversation that we're going to have this morning.
I as well.
Lizette, can you tell me a little bit about yourself and what do you do?
Sure. So my name's Lizette Esquenazi, and I'm a licensed agent. I'm contracted with UnitedHealthcare, and I help people learn about Medicare, understand Medicare, and the options that they have to help them get the most out of Medicare.
So tell me a little bit about the Medicare and what are the options that people have on Medicare?
Yes, that's a very good question. So when a person becomes eligible for Medicare, Medicare doesn't cover everything, right? It doesn't cover all the costs, and it doesn't cover a lot of additional benefits like dental services, help with the cost of eyewear, help with the cost of hearing aids, and a lot more. So because of that, people do have a couple of options that they can choose from. One is to buy a Medicare supplement plan that will act as secondary insurance to UnitedHealthcare, but that can be kind of expensive for some people. So the second option is to enroll in a Medicare Advantage plan. And a Medicare Advantage plan, what it is Part C of Medicare, and it combines the benefits that you're entitled to under Part A of Medicare and Part B of Medicare. And many Medicare Advantage plans also include Part D prescription drug coverage, and a lot of them also have those additional benefits that Medicare doesn't cover, like dental, vision, hearing, and more.
And how does a person goes about deciding if staying on regular Medicare or this other product that you call Medicare Advantage? Who can guide them?
So that's a very good question. So they can come to a person like me. I'm an insurance agent, like I mentioned. I'm licensed with the state of Texas. I'm exclusively contracted with UnitedHealthcare, so I offer UnitedHealthcare's Medicare solutions. There are also other agents who are considered brokers, and a broker is a person who is a licensed agent, but they can offer plans from different companies, from several different companies. And so they can come to a person like that who can guide them and give them all the information that they need to make an informed decision. And I believe that South Alamo Medical Group is going to have some Medicare information centers at some of their clinics. Am I correct about that?
Yes. Now, you mentioned that brokers handle different Medicare Advantage. Are all the Medicare Advantage products the same from the different insurance companies?
That's also a very good question, Dr. Ross. And no, not all plans are the same. And I will say that with UnitedHealthcare, you get more than a plan with benefits. For one thing, the benefits between one plan and another can be very different. I mean, pretty much all Medicare Advantage plans offer the standard Part A and Part B benefits. But some of the additional benefits that the plans offer can be very different from one plan to another. The other really important thing to consider when you're evaluating a Medicare Advantage plan is the star rating.
Oh. Tell me about the star rating. What is that?
So the star rating is a way that the Center for Medicare and Medicaid Services, which is called CMS, which is basically the federal government, evaluates the Medicare Advantage plans and prescription drug plans every year. And they use this star rating system where 1 star is poor and 5 stars is excellent. And for what they look at when they're evaluating these plans, it's a long list of things, but some of the things that they look at is our member satisfaction. So how our members rate the plan's services and care. Yes. And then they also look at the quality of care. So the clinical outcomes, how well our doctors detect illnesses and keep members healthy. And so it's important to look at the star rating on these plans because that's going to tell you the kind of quality that you're getting with that plan.
You said outcomes for illnesses, but is there prevention?
Yes, of course, Medicare Advantage plans are very focused on proactive preventative care. And in fact, one of the reasons why I choose to solely offer UnitedHealthcare's Medicare solutions is that I believe that UnitedHealthcare is very focused on helping its members live happier, healthier lives. And so through our provider networks, which South Alamo Medical Group is a part of, we help our members live happier, healthier lives by really looking at getting the members in for all their tests on a regular basis and providing that proactive preventative care for them.
Okay, well, good, good. Can people just get into these programs at any time?
No, that's also a very good question. So for a Medicare Advantage plan, you have a specific period of time in which you can make changes to your plan.
Okay.
And that is called the annual enrollment period. And that period, it's coming up very soon. It's October 15th through December 7th of every year.
Okay.
And during that time, a Medicare beneficiary can make whatever changes they want to their current coverage. And when they enroll during that annual enrollment period of October 15th through December 7th of every year, their new coverage will start January 1st of the following year.
Now, how does a person qualifies for one of these Medicare Advantage programs?
That's also an excellent question. So in order to qualify for a Medicare Advantage plan, you have to have Medicare Part A and B. So you have to have the original Medicare. Okay? And just so we can cover who qualifies for Medicare, a person qualifies for Medicare at age 65 or under the age of 65 if they have certain disabilities. So to qualify for a Medicare Advantage plan, you have to also qualify for Medicare Part A and B, and you have to have that. Yes. You have to live in the plan's service area. So every Medicare Advantage plan covers a specific area. And for 2020, you cannot have end-stage renal disease if you want to enroll in a Medicare Advantage plan.
For 2020?
For 2020.
Now 2020 is coming to an end.
Right. I understand there are some changes coming for 2021 in that where people will be eligible, if they have end-stage renal disease, they will be eligible to enroll in a Medicare Advantage plan.
So, Lizette, are there any five-star plans in San Antonio?
Well, I'm happy to say that there is a five-star plan in San Antonio, and UnitedHealthcare is the only Medicare insurance company in San Antonio, Texas that has a five-star rated plan for 2020.
So the government evaluated them on quality and prevention and how they take care of their members and the quality they provide and the outcomes that you mentioned, keeping people as healthy as is possible.
That is correct. So as I mentioned earlier, the Center for Medicare and Medicaid Services every year looks at these plans and evaluates them. I believe it's about 40 things that they look at. I'm not exactly sure, but I've heard that somewhere. And but the focus of their evaluation is on the member satisfaction, and then most importantly, on the quality of the care that they're getting from their providers, so from their doctors. And so for 2020, UnitedHealthcare is the only company in San Antonio to have a five-star rated plan.
Okay. And how long has that been since?
Since for this year, for 2020.
2020?
Yes.
Okay.
And we're hoping to have the same rating for 2021, but we don't know yet.
You mentioned also that there are different companies here in town that offer Medicare Advantage. Yes. Do they all provide the same benefits?
That's a very good question, and as I mentioned before, all the plans are going to cover what they have to cover, which is all the Part A benefits and all the Part B benefits. Where they're going to differ is, of course, in cost, right? How much it costs for those different benefits, and also on the additional benefits that they provide. So benefits that original Medicare doesn't provide, like dental services, help with the cost of eyewear, help with the cost of hearing aids, gym membership, transportation, and a whole lot more. So that's where they're really going to be different, in the cost and in those additional benefits.
When you mention cost, is it something that a person needs to pay?
Right. So Medicare Advantage plans do have cost sharing unless you're a person who has Medicare and Medicaid. If you have Medicare and Medicaid, then you will have no cost sharing. But for people who just have Medicare, and if they go on a Medicare Advantage plan, you do have some cost sharing, so you'll have a copay for certain benefits. The good thing about Medicare Advantage plans is that they all have what's called an annual out-of-pocket maximum. So what is that? An annual out-of-pocket maximum is the most you'll ever pay within a calendar year for your Part A and Part B covered services. Okay. So it's like a financial safety net, because it says that no matter what happens to your health, if something catastrophic were to happen and you were having to use a lot of the benefits and you were paying your copays, if you reach that amount, then from that point to the end of the calendar year, you're covered at 100%.
How does a person goes about evaluating the benefits of one plan with another? That's
an awesome question. So every year, the Medicare Advantage plans and prescription drug plans are obligated to send their members what's called an annual notice of change. And the annual notice of change is a little book, and in that book it shows you what the benefits are for the current year and what's coming for and what the benefits are for the coming year. And so you can make a comparison of anything that's changing. Now, if you want help with that, you can always reach out to someone like me, an insurance agent, and I can help you navigate through that. Also, at the South Alamo Medical Group clinics, we also have agents that are there to assist as well. So those are a couple of different ways. Also, there are other resources. Every Medicare beneficiary every year gets a handbook. It's called the Medicare and You Handbook. And in there, there's all the information on the different plans in the area. But, you know, sometimes that's hard to navigate. So that's where we come in, and we try to simplify it and explain it in a way that's easy to understand.
Yes, because I can see the government writes in a certain way, but we all talk different.
Right, right. Sometimes, even when I read it, and I've been doing this for over 10 years, even sometimes when I read it, it's kind of complicated. So it's always a good idea to reach out to your insurance agent if you have one, and if not, we're available at the South Alamo Medical Group clinics to help you with those questions and to help you navigate through what can be complicated sometimes.
Now, how do they get in hold of you? Do they need to make an appointment to come and meet with you or somebody like you?
That's a great question. So I am currently at the South Alamo Medical Group clinic on East South Cross every Monday from 10 in the morning till 12 p.m. During the day on Mondays. I can also be reached through my telephone number, which is 210-487-8952. And those are the two ways that you can get a hold of me. If you don't want to go to the clinic, you can always call me and we can set up an appointment. We can either do an appointment, a presentation by phone if you don't want to meet, because I know we're in the age of COVID right now. We can do a phone presentation, or if you're okay with me coming to your home or meeting at a coffee shop or something, I will wear my mask, I'll have the hand sanitizer, we'll sit apart, and I'll go over all the information with you.
Okay. I wanted to ask you something. If a person considers that a specific plan, because of the quality and the benefits, is something they want to consider changing to, do they have to change their doctor?
So, you know, that's really important to look at when you're considering a new plan. you know, every plan has its network of doctors. And so, you know, one of the things that I like about UnitedHealthcare, and one of the reasons why I exclusively offer UnitedHealthcare to my clients, is because they have a large, extensive network of doctors, of which South Alamo Medical Group is an important part. And so if you choose a UnitedHealthcare plan, I can tell you that you would not have to change your South Alamo Medical Group doctors. So that's good. But it is important when you are evaluating a plan to ask the person that's helping you enroll in the plan to make sure to check that all the doctors are in the network. Another really important thing to look at is, are my prescription drugs on the formulary?
Yes,
because
yes.
the formularies are different from one plan to another, so it is important to also take a look at that. So doctors and prescription drugs.
Okay. And you mentioned something that we're coming up to being able to, one, evaluate the new benefits from the plans and the time that people can change.
Right.
Right?
Right.
So can you remind me again when what you mentioned, the annual enrollment period starts?
Sure. So the annual enrollment period, as I mentioned before, is the period when all Medicare beneficiaries can make changes to their current coverage. As I mentioned, they're going to receive their annual notice of change on the first part of October. They can look at the different plans, and if they want to change plans, they'll have to do it from October 15th through December 7th. And then their new plan will start January 1st.
Okay. Very well. Liz, you cover a tremendous amount of material.
A lot of stuff, yes. Medicare can be very complicated, but one of the things that I take pride in is helping people understand it, simplifying it for people so that it can be understandable.
And you mentioned you're going to be, you are at the Southeast location, the South Alamo WellMed office.
Right.
And we have also South Alamo Medical Group. WellMed has offices, a division, and a large office at the Westover Hills, as well as here at Barlight campus. So there will be also agents at the different offices.
That is correct. In fact, some of the agents that are on my team, Jerry Dellano and Suzanne Bruni. Suzanne Bruni's here at Barlight. I don't have her schedule, so I'm sorry about that. And then Jerry's over at the division clinic. But there will be agents, especially throughout the annual enrollment period, actually starting October 1st. There'll be agents at the clinics to help you with any questions that you may have about Medicare and about Medicare plans.
Wonderful. Good. I think this is very, very useful information for all of our patients. Thank you for coming. Thank you for explaining to us the process of considering the Medicare Advantage, the benefits of the Medicare Advantage that are coming for 2021, and how our patients and the population at large that has Medicare can enroll in one of these wonderful, wonderful programs.
I was happy to be here. Thank you so much for the opportunity.
And if it wasn't because of the COVID, I will shake your hand.
Yeah, same here, doctor. Thank you.
Thank you.